emergency consultant is urging people to help the NHS to help them as it faces its most challenging winter. Hospitals and GP practices are having to cope with COVID-19 on top of the usual pressures triggered by colder weather. The NHS in our region says it's vital for people to use the right services for their needs to ensure our emergency departments are free for the sickest patients. There are flashing images from the start of this report from our health correspondent Helen Ford.
As the temperature drops, the pressures increase on the NHS. Here in the emergency department of Newcastle's Royal Victoria Infirmary, staff are used to working intensely. Even so, this will be a winter like no other, thanks to the complications of COVID-19.
Winter is very challenging because we see an increase in respiratory cases, and this year what we'll have is an increase in coronavirus. The problem, of course, is the patients don't come with a label on the head saying that they have coronavirus, so we have to isolate them, assuming they have it. And, of course, seeing every patient is taking at least twice as long because we have to put on our PPE for every case.
During the spring lockdown, there was a huge fall in the number of people attending the region's emergency departments. While we're still not back to pre-pandemic levels, even so, units like this are busy.
We've got a limited amount of rooms or areas which we can see these patients, and obviously some of them are quite poorly as well. We see quite a lot of vulnerable patients in the department, and obviously we're very conscious of not mixing any potential COVID patients with those patients who are unwell.
With the prospect of even greater demand to come, people with less serious conditions are being urged to seek help elsewhere. At this GP surgery in Northumberland, the pandemic has had a major impact on the way care can be provided. But despite the pressures, GP Lily Lamb says patients shouldn't be afraid to get in touch.
It's really important that people come to see us if they need us, because if there's something more serious going on, like an underlying cancer, it's very important that we pick up on that early and get people the right kind of investigations and treatment that they need as soon as possible. And whilst we're certainly busy at this time of year, we're very much open and we want to hear from people.
And before a winter when no one knows precisely what's ahead, consultant Baz Sen has this message for anyone planning to walk straight into A&E.
What we would suggest is they ring either their local pharmacy, their GP, or 111, depending on the time of the day, where they will get the right advice and they will be directed to the most appropriate service.
Even in the hospital waiting room, there's no escaping the impact of COVID. And as the NHS faces its first winter in the grip of the pandemic, it's urging all of us to do our bit to ease that pressure.
Helen joins us now. Helen, we hear about winter pressures on the NHS every year. It seems that COVID has taken this to a new level in 2020.
Well, we all know how busy our emergency departments can be during the colder months, but this year, capacity has been reduced by up to 50% because of the need to social distance. And as a result, we're all being urged to think about whether we should approach NHS 111 or our pharmacies or GP practices as a first port of call unless we have a life-threatening condition. Now, right across the northeast, all these different services are working more closely together in order to smooth the pathway for patients. So if they approach one in the first instance, it helps them to move on to another potentially. One other really important point to bear in mind, the emergency consultant who we heard from in my report, Baz Sen, says if you turn up at A&E with a fairly minor condition, yes, you will receive an initial assessment there, but you may then be redirected somewhere else for your treatment.
That sounds sensible and efficient. Helen, thank you very much.